Hi everyone, and welcome to our podcast. I am Aurora here with the host Thomas, and we are interviewing Karen, who is the CEO and founder of Soundwave Music Therapy. Welcome, Karen.
Thank you for having me.
Yeah, so we're just going to dive right in. So the first question is, what is music therapy and why is it beneficial?
So, the way that I describe music therapy is kind of quick in a nutshell, the way that we are accomplishing non-musical goals through music. So, the way that it might look a little different than what you have per se, like, a form of entertainment, is that we care everything is client centered around the individual, and we are accomplishing non-musical goals through music. So it might be motor goals, speech goals, communication, emotional, psychological, sometimes spiritual goals. And we are working towards those goals just by using different elements in music. So whether you're playing with, let's say, I like to give examples. So whether we say that we are working with speech and communications by doing, like changing different speeds that we're playing with music, pausing, stopping, eliciting chances for that communication to come out in vocalizations, or it might be more motor domain and doing things that you see as, expressive movement, which is more dance based. Just everything is a little different, but the main thing about music therapy is that it's individualized, it's client centered. Everything revolves around musical preferences of each individual as well. So non-musical goals, that's what we're aiming towards besides the musical.
I love that, and I've seen you guys and some of your therapists working with the kids. It's amazing. But let me ask you, what got you into music therapy?
So what got me into it is kind of personal experience. It wasn't necessarily music therapy, but it was a musical setting. So back when I was in high school, one of my closest friends had autism, and I noticed that she responded a little bit differently to others and her peers in a social setting of the band room. So she responded different in a musical setting than she did in anywhere else in the school. And I noticed she might, initiate conversations with peers more. She might be a little bit more receptive, and just listening to others, listening to instructions and everything. And she just affect. She's so much happier, as well by the end of a session that we were, or not a session, but at the end of a time that we just had a band practice. And just seeing that change in emotion, I think, was kind of the main thing that I wondered, there's got to be more to this. Why is she not acting this way anywhere else that I've seen her? And I wanted to learn more.
That's so cool and having that firsthand experience to see, the way music can help someone and the ability it has to, help children, people with autism. Really, I mean, is there a specific, you know, type of person that you like to work with or that you feel is the most beneficial?
So that's a great question because music therapists were trained to work with all populations. And then we just kind of find along the way maybe an extra passion that we have. So like one thing, for instance, people don't know about Soundwave is that we serve everybody from age 0 to our oldest client is 114 years old right now. Um, Myself, my specialty, my love, my passion is pediatric with medical complexities. That is my love. So specifically working with like quadriplegic CP, anything that the more complex is just kind of where I fall in love. I would say specifically anyone that has more nonverbal communication is kind of my personal passion. I love working with autism as well. I would say that's a very close second place. But like each of our therapists are specialized in a variety of settings, but we all have extra passions. I will say that our therapists that are at Tender Care, like they love pediatrics. We have like Jerica, for example. Jerica loves working with very similar to me, maybe a little bit lower cognition, whereas we might have Abby that loves working in group settings, and just being able to see a little bit different. But myself, the PPEC setting is my love. So that's why we love to be there.
I, I love that. And I love when I get to go in there and see Jerica working with the kids and, you know, the smile that the music puts on their face and the way they interact with it. It's just amazing to witness and getting to do that every day, as a job. That's pretty neat. Um,
It
Aurora,
is, it is. It's very rewarding.
yeah, and I know last time we were there, Aurora was able to go
Mhm.
take some video as well, and um, just seeing the way that the child responds to the music, it's amazing.
I agree. We have our hiccups sometimes, it is a therapy. People forget
Yes.
like, oh, well, music therapy, like it's got to be fun. And I'm like, well, it is a therapeutic process. We have some of those days that we might have some tears and some screams, but uh, we work through it, you know?
Yeah. Well, I can't say that everything is always rainbows and butterflies, but you would think you would think most of the time with music you're getting a good response.
I would say 98, 99% of the time is pretty good responses.
Yeah, so with that, what are your certifications?
So, in order to practice music therapy, certain states in the country require licensure. Florida, for example, does not. That being said, each music therapist that we have at Soundwave, with the exception, I think there's maybe one that we're working with that I oversee right now, we are all music therapist board certified. So that being said, each of us have gone to school 4 to 6 years minimum, in which we have to go to a music therapy accredited university. After that, we do 1,040 hours of a clinical internship and practicum site in which we're in the field, we're working on it, we're learning what are we doing, and that's supervised by an MTBC. After we've graduated, we take the exam in which it shows our competencies and it's a national accreditation. So in order to find a music therapist, like there's a website, cbmt.org, certified board music therapist.org. You can search anybody and just find out, are they board certified, which means have they taken that exam? Do they keep up with every 5 year? We have to have 100 continued music education credits. The same things that you see very, very similar to OT and speech and PT is those continued educations as well. It keeps us up to date on research and helps us provide the best care. So MTBC is our main credential you got to keep an eye out.
I didn't realize that there was that much involved in it. Obviously, therapy as you think, but I to realize that much schooling, that much training, and everything that goes along with the certification, that's pretty impressive. How long have you been practicing?
So I have been practicing about 5 years at this point. What's a little different on my path is my master's is in psychology.
Okay.
So that's for me, which is a little bit different. So I went to school for psychology before going into music therapy and then spent those same years that I was just talking about. So I've been practicing for 5 years, of which, in addition to those 5 years, I had an additional 2 years in which I was in PPEC settings.
Wow.
So I've been in PPEC settings for 7 years, been board certified for 5 years.
Very cool. Now, do you find that your psychology background helps you working with the children in the PPEC setting?
Incredibly. The reason I say that is because I understand the developmental goals, just even a little bit more. That's one of our things that we are very proud of at Soundwave as well, is that you know, I have that extra level that I supervise all of our therapists and make sure that they have that extra step of an understanding as to what are we looking for? What are those goals that we're doing? And of course, in music therapy, when you're in school, I describe it as we have three components of training. We have to know our psychology, we have to know our music, and then we have to know our music therapy. How are we actually providing care? The good benefit of us is I just have an extra component of psychology. So all of our therapists just have a little bit of an edge in that aspect.
Very neat. I'm sure very helpful.
Absolutely.
So you've done 5 years of music therapy, but when did you start Soundwave?
So we started, believe it or not, a little less than 2 years ago.
Okay.
So we started, it was just myself in the beginning. One problem that music therapists have, this is all across the board, is that there are a lot of settings that we're found in, but there's actually not that many jobs in those settings. I found that I practiced in a variety of populations before starting Soundwave. I worked in inpatient psychiatric, I worked in forensic, I worked in substance abuse, I worked in autism clinics, I worked in all of the above. And I decided one day I want to specialize, but that's me. I want to start a practice that I can grow, we can expand, we can teach and educate and have a practice that's by music therapists for music therapists. And we help them through these obstacles and help develop them. So Soundwave I created was because I wanted to create a team that we nurture and we empower everyone to find their passion. Um, and now, less than 2 years later, we have a team, including our care coordinator, of 9 people. So, and we are growing very quickly, and that's completely accredited to our team and our clients.
It's amazing, that you have that and you've grown that. But when you have the right team in place and you're able to put the right people in, and they're working with their heart and doing it for the love of what they do, it shows. So when we're able to go and see, your therapist working with our kids, you can see that they truly love what they're doing. So that makes a
Mhm.
difference, and that's probably credit to the success you've seen so far, is because you're putting that team together that loves what they do.
Oh yes, our therapists are everything. I say to them all the time, like, we have to emphasize teamwork because that's how we provide care. Is I'm just a piece of the puzzle. I oversee the therapies, but I'm not always necessarily the boots on the ground, lack of better terms.
Right.
But that's a benefit we do have is I can oversee and make sure that we're providing the best quality as well.
That's fantastic. Now, where are you located?
So we are based originally out like throughout greater Jacksonville and St. Augustine area. Um, that being said, we do technically have a physical clinic in North Jacksonville. We don't really see that many clients there. The main areas that we service geographically actually is all throughout Northeast Florida. We have, I believe, 8 or 9 counties at this time that we see. We're hoping to expand even further. So we just have to have staff, and that's the next step. But we are very excited to grow. But right now we're located primarily across Northeast Florida. So we provide care in, of course, the PPEC setting, but it might be other locations as well. Like I said, we serve 0 to 114. Right. So we might be in nursing homes, we might be in substance abuse facilities, we might be in autism clinics. But our main settings that we do are PPEC settings and also home environments. We go and we bring the services to the house. We provide the instruments, we provide everything and make it accessible to those that maybe transportation is a little bit difficult. And we just want to take that extra step further as well.
Now, with that, two things. One, I know that, give a little hint towards it. We're hoping that you expand a little bit further than the Northeast Florida. And
Mhm.
um, with your services, are they covered by insurance?
Excellent question. Sunshine CMS Medicaid covers at no cost to the patient. So 100% is covered. At this time in the music therapy world, that's the only insurance that covers it.
Okay,
Luckily, in a PPEC environment, that might be a little bit more standard insurance that we see. At this time, it is the only one covers, but it's at no cost to the individual, and we can provide those
that's
services.
fantastic.
And
Now,
that covers group and individual services as well.
oh, okay, that's great to know. Now, if just throw this out there, if there was another PPEC that's not us, that would love to provide these services for their children, how would they go about that in contacting you?
The main way that we have, and it's just we have a website that you can see. We're in the process of revamping it, I will say. So I would say right now the easiest way to contact is through our Facebook page. So you can just go to Facebook and search Soundwave Music Therapy and send a direct message. We do have a care coordinator. So our process shows you send a contact to that. She will be the one reaching out to each of the families. So if you just send us an email and say, hey, we've got interest, or if in the PPEC setting, speak with the director of nursing and say, hey, I've heard about this. I would love for my kid to learn this. They can send me an email as well. My name, just K Howell at soundwavemt.com, and just say, we're interested. And then we take all the steps going forward. We contact the doctors. We take care of everything.
That's fantastic.
Yeah, that's amazing. Also, I've been seeing you around the St. Augustine area and in Jacksonville. So I just want to ask, what are you doing in the community?
We are at a lot of marketing expos right now.
Mm.
Um, just kind of trying to expand and provide care to as many populations as we can. Um,
Right,
like I said, my personal passion is a PPEC environment, and that's Soundwave's passion is pediatric is, I would say, probably 60% of what we love and what we work with on a daily basis. So in the community, you'll see us everywhere. Like I said, it could be an autism clinic, it could be a nursing home, it could be a
mm,
substance facility, it could be an inpatient psych, maybe anywhere that you can imagine that really music can be used to, like I said, accomplish those non-musical goals, maybe things that are a little tough to reach. You can probably start to find us there.
right. Yeah, I've seen you at various expos, and usually at your table you have a bunch of musical equipment, and the kids just love it. So it's
They
really,
gravitate.
yeah, it's really fun to see you at those expos, and especially if your table is right next to hers. So then everyone goes to her, but then they're right next to you, so it's
And they
perfect.
just go on over. Yep.
Yep. So,
Strategic partnership there.
It is. It is.
But that's actually that's how we first met you, isn't it? At our
Hmm.
Resource Expo last year.
Absolutely. So that was we've been been hanging out with you guys for a little around a year now. So
Yeah,
yeah, the expo last year was kind of our first endeavor into St. Augustine actually.
wow.
And that was where we met you. We're super excited about the one coming up soon. We'll be very happy that we're doing kind of a percussion demo there with some of the kids, and not just kids necessarily that are current participants over at Tender Care, but it'll be open and it's just about community engagement as well. So we are very excited about that coming up.
yeah, we're thrilled that Aurora's been working so hard on getting this all together. She's done a phenomenal job. She's got, I think we've got 50 resources signed up right now.
That's so
Um,
exciting.
Adaptive Dance Superstars is going to be doing a performance.
I
Um,
heard.
it's inside this year because we know it was a little hot last year.
It was a little
So it's at
windy
a mall
last year, and
21,
that's okay.
21. So, everybody, can stay cool. It will be air conditioned.
Yeah.
We're hoping to get a lot of foot traffic through. And
Yeah.
I'll let Aurora, she can speak a little bit about that, but she's done a phenomenal job.
Yes, so what we are referring to is we are having a special needs resources expo on April 15th. It is from 1 to 3, and it is at Mall 2121. And we will have a dance performance from Adaptive Superstars and lots of vendors. So please come out. It'll be so much fun.
And even if you're in the special needs community or you have ties to anybody that could use these resources, it's going to be a phenomenal educational event for you to come out and see everything that's available. We go to these different things, and most of the time you don't know these services are available. Just like when we met you, we didn't realize music therapy was available like it was to the
Mhm.
population we serve. And being able to go out and add these things and any type of benefit to the child that we serve is just great. And it gives us the chance to work with you and build relationship with you, and hopefully that becomes even bigger and we can help serve more children.
Absolutely.
Yep.
So we've talked about you work in the PPEC setting, you've worked in a nursing home. If besides PPECs and stuff like that, if there was one place that you could get in or you could help make a difference for the children, where would that be?
Oh, that's good. I would say, actually, believe it or not, a virtual setting as well.
Oh,
Okay.
Um, because of that, we noticed so much during the COVID times that, you know, we've we've all seen symptoms have emerged since COVID as well, right? We see so frequently, like I said, whether it's the medically complex children, whether it's kids with, I mean, it doesn't matter, any sort of needs, any sort of abilities. There are already some platforms that incorporate like at home things. There's actually, I just discovered yesterday, I was at a sensory concert yesterday, which was with the Jacksonville Civic Orchestra. And it was specifically geared towards children with special needs that needed sensory accommodations. And I went to it yesterday, and I learned about a place called Music for Autism, which is an online platform that provides, I love doing plugins for things like this because I was excited. It provides concerts that you can just watch at home that is engaging. And to my knowledge, and feel free to research it, to my knowledge, it's just free concerts. And,
Wow.
They lead, whether it be a more movement based and just kind of some things that you would see as music therapists as well. They're in consultation with music therapists. So, being able to kind of continue into virtual platforms as well. I think it's just something that I would not say that would be like the bread and butter of what we do at Soundwave, but I think it would be an additional thing we can do. My love beside PPECs, though, which is what we love doing at Soundwave, is going in homes, because it's just different. You get to see that environment, you get to see those family and sibling connections, and that's the setting that I love getting to observe our team members in, is just seeing how kids can respond a little bit differently at home. Sometimes they might be more behavioral at home. Some of the behaviors just might escalate. It might be harder for them to regulate, and just bringing in that inviting medium in the home setting, whether that's virtual or in person, I would say is really an area that continues to interest us at Soundwave.
That's you brought up a great thing. I never even thought of music therapy doing it, online. But
Mm-hmm.
with the technology, I mean, how we're doing this today, I definitely see how it's feasible and how it's a thing. Just like before COVID, I never thought that they would do, occupational physical therapy, via telehealth or online, which, as much as COVID disrupted the world, it did bring some good things.
Yeah, and
Yeah.
like in our field, we had to learn to adapt majorly. I
Yeah.
mean, in the beginning, as we know, with a little bit of lag time, whether it's 1 second, if you're playing a guitar and it can't pick up the guitar, and the person's trying to sing and you're trying to sing with them and you're not able to at the time, luckily some things have been fixed around that, which is why I still say virtual is not my necessary number one that I think is appropriate for everybody. But it is something in a long-term goal we might be able to work towards as well. But I would say right now, just continuing in those PPEC settings and
Yeah.
really just in home is where we love it.
It sounds like you're just, the more people you're able to touch, so whether that's
Absolutely.
PPEC in the home or virtually, if you're able to touch and help these people, you're making a difference. I think that's phenomenal.
Yeah, and that's one thing we really love about what we do is we serve all abilities, and we serve all abilities with any need you can imagine. I say all the time that one thing people don't know about Soundwave is we are a private practice. We do more than work in one specialty. Our director of operations, for example, Stephen, works exclusively in substance abuse settings. And he does numerous hours a week with those individuals that suffer from addiction. And just knowing that what we do at Tender Care looks dramatically different than what he does. But it's still music therapy, and it's used to touch all those individuals.
That's amazing.
That's very fascinating, like how many people benefit from music therapy and how many people
Mm-hmm. Yeah, and I say sometimes like that's part of being that MTBC, that board certification, is knowing that very rarely, but occasionally someone might not be appropriate for music therapy. Very rarely I say that, but maybe it's someone that is just a little bit too much stimulation at that time. Maybe it's just somebody that if you're taking them away from whatever setting they're in to be able to go to a session, maybe that's not appropriate at that time. It's rare. I would say we don't come across that very often. But there are times that maybe someone's not suitable, and that's part of our process as music therapists is assessment. We do assessment, we do documentation, we do treatment planning, we do discharge as well. and just there might be those very rare occasions that someone's not appropriate to, and that's part of the MTBC credentials. We can identify that. But for the most part, we don't run across that very often. So it's, we just love providing care. We're passionate. So
we mentioned that the Sunshine CMS covers music therapy. Is there any other insurances out there, but not for the PPEC setting, but for anybody else who might be listening, that has a private insurance, or the private insurances cover music therapy?
So at this time, Sunshine is the only one. However, we are providers for Family Empowerment Scholarship or Step Up for students for unique
Okay.
abilities. We are a provider for that, as well as we do a sliding scale pay as well, just kind of working with families the best that we can. And that might be a kid, instead of an hour session, does a 30-minute session. And just adapting and just meeting the best that we can for where the families are at. But we are a Step Up for Students or Family Empowerment Scholarship provider as well. And you can contact us the same way, and we can set up everything again through our care coordinator.
Fantastic. And your new care coordinator, I believe we've met her before, and she is pretty amazing herself.
She is.
I was very happy to see that she was with you when we seen you this past weekend.
Yep. So I'll speak to Brittany. Brittany has a podcast as well that she sometimes does that works towards parents and families of children or just anybody with special needs. And so we have that extra understanding from our care coordinator that she gets it. Also, not just the administrative components, and she processes. She does everything that is involving the doctors and that beginning to end process to start to serve your kids. But she also gets it. She's a parent, and she's excellent at what she does. And we're very fortunate to have her. So she's one of our team members that's very new, but she's there to hold your hand throughout the process.
I think that position suits her very well with her passion for helping families, and the ability to now they reach you, that she's able to help coordinate that whole thing. It eases the parents,
Mm-hmm.
the process for the parents, and that's one of the hardest things. A lot of this stuff, the parents have to jump through hoops. So when
Exactly.
you're able to make that process easier for the parents, it makes a big difference.
Oh, absolutely. She's an integral part of Soundwave. She's not a music therapist, but oh my goodness, is she important.
Yeah,
So she makes it happen.
that's fantastic. Was there anything else that we missed, Aurora?
Not on my end. Karen, is there anything that you wanted to explain further?
Um, Not really. Not that
All
I
right.
can think of.
Did you
Well,
have any questions for us?
Um,
It's okay if you don't.
I don't think so.
All right.
I was hoping that I would, but I was trying to think of things and I was like, I don't know that I have any.
Well,
We're just always happy to see you guys, whether it's at an expo or whether it's in one of the centers, and we look forward to continuing to serve as many as we can and continue this partnership.
yeah, we hope this partnership continues to grow, and I think it will. Hopefully soon we have some exciting news that we can move forward with, and then as it goes on, uh, just continue to touch and reach more families. And I want to thank you for being our first guest. We don't even have an official
Yeah,
name for the podcast yet, but you know
that's
we
okay.
we wanted to get this going and get this started, and help promote for the upcoming expo and get you on. And I think we're gonna look to have a few more guests, but we thought you'd be the perfect first guest, so thank you for
Well, I
being.
appreciate it. I appreciate it. Like I said, you'll see all of our therapists. My role is I'm the clinical director at Soundwave and oversee things, but you will see many of our therapists and they are passionate and oh my goodness, do they love working with everyone.
Love it.
all right. Well, thank you everyone for listening. You can find Karen on the Facebook page Soundwave Music Therapy, and sound is one word. And we hope you listen next time. Thank you.
Thank you.